So, your due date has come and gone, but your baby seems to be enjoying their stay in the womb a little too much. What is going on? In this video, we're diving into the world of overdue pregnancies, and we're going to talk about why some babies delay their grand entrance and what steps you and your medical team can take. But before we jump in, I'd love to know what brought you here. Are you overdue right now, or is your due date just around the corner? Go ahead and let me know in the comments section down below. Let's start by talking about why your baby might be overdue. Determining your due date is a key part of your pregnancy journey, and your OB or midwife typically calculates this by counting 40 weeks from the first day of your last menstrual period. However, if your periods are irregular, this method might not give the most accurate due date. In those cases, your OB will use an imaging technique known as an ultrasound to measure your baby's size and help determine a more precise due date. Now, a pregnancy is officially labeled overdue if your baby isn't born by 42 weeks, which is 2 weeks past your official due date. This is what we call a post-term pregnancy, or a post-date pregnancy. The exact cause of an overdue birth usually isn't known, but there are a few factors that can contribute. These include being in your first pregnancy or having previously delivered a baby after your due date. An overdue birth can lead to several potential issues. Babies born after 41 or 42 weeks might be larger, weighing more than 10 pounds, or about 4.5 kilograms, which can lead to complications during delivery. They may also pass bowel movements, or meconium, into the amniotic fluid before birth, and this can pose breathing problems after delivery. If your pregnancy continues past your due date, your healthcare provider will talk with you about next steps. In many cases, experts recommend using medications to induce labor if you haven't gone into labor on your own by the 41st week. If induction is recommended but your body isn't quite ready, your OB can give you medications to help get labor started, and this process is called labor induction. Alternatively, a C-section might be performed in certain situations. For example, if labor-inducing medications aren't effective, if the baby is too large for a vaginal delivery, or if complications arise during labor that require an immediate birth. Now, despite these potential complications, it's important to remember that most babies born after their due date are perfectly healthy. They might show a few distinctive traits like longer, thinner arms or legs, dry or peeling skin, or even longer hair and nails, but otherwise, they do just fine. And as always, your OB or midwife will provide all the necessary care and guidance during this time to make sure that both you and your baby stay healthy. If you're getting close to labor and you're not sure how to tell whether you're having true labor contractions or false labor Braxton Hicks, I've actually made a full video explaining how to tell the difference between the two. Thank you so much for watching.